Hi everyone, my name is Katrina Lobbs and I'll be presenting on the therapeutic relationship. Making a lifestyle change is definitely challenging, especially when you want to change many things at once. Lifestyle changes are a process that take time and require support. According to a March 2000 APA poll conducted by Harris Interactive, quote, fewer than 1 in 5 adults report being very successful at making health-related improvements, such as losing weight, starting a regular exercise program, eating a healthier diet, and reducing stress. Myself, as a healthcare provider, designing interventions to yield changes in behavior is best done with an understanding of different behavior change theories and the ability to use them in practice. Understanding patient readiness to make change, appreciating barriers to change, and helping patients anticipate relapse can improve patient satisfaction. Both the trans-theoretical model, abbreviated TTM, and motivational interviewing, abbreviated MI, are a natural fit. According to Miller and Rolnick, quote, TTM is intended to provide a comprehensive conceptual model of how and why changes occur, whereas MI is a specific clinical model to enhance personal motivation for change. The stages of TTM provides a logical way to think about the clinical role of MI, and in turn, MI provides a clear example of how practitioners could help clients move from one stage to the next. It is essential to match behavior change interventions to people's stages. Without a planned intervention, such as MI, people will lack motivation to proceed through the stages. In the pre-contemplation stage and the contemplation stage, clients are lacking confidence, motivation, and direction to make a behavior change. In these stages, the practitioner should encourage a client to create their own motivation for change. It is the practitioner's job to draw out the client's motivation and skills for change and not tell them what to do. In the preparation stage, the client has made a commitment towards change and they may have even attempted to develop a plan for change, but have not yet taken any formal action. MI can work in conjunction with TTM here by collaboration. Collaboration at the stage can produce a partnership between the client and the practitioner. In this stage, goals and plans are created with and for the client that can lead to change. In the action stage, the client is actively involved in changing behavior. Most people in the stage require some form of assistance to reach their goal. This is where the practitioner and previous work come into play. The practitioner can begin to empower the individual, which gives the client responsibility for their actions. In the action phase, the practitioner can remind the client there is no right way to change, but there are multiple ways to make a change instead. By doing this, they do not get discouraged if they are not making the change like they have originally planned. In the maintenance and termination stage, the client has developed an aspect of efficiency and will eventually continue to improve. At this point, the client is typically living their change and may not need help of the practitioner anymore. But because their relationship has been built on trust, the client is confident that they can continue their behavior change without the guidance of the practitioner. Because MI and TTM are used together, it can create a more successful environment for the client to make change. To successfully navigate MI, the practitioner must recognize change talk when it occurs. Change talks are statements made by the client that indicate they are moving towards making a positive change in a problematic behavior. The acronym DARN CAT is used to help practitioners describe various types of change talk. The two parts of the acronym are separated purposefully. DARN representing the preparatory phase. DARN stands for desire, ability, reasons, needs, and this means the client is preparing to make a change. So in the first 3 stages, the first part of change talk may have occurred. So the acronym DARN represents the preparatory phase and informs the practitioner the client is preparing to make a change. The acronym CAT represents the mobilizing phase. CAT stands for Commitment Language, Action, and Taking Steps Towards Change. Simply spotting change talk is not MI and does not elicit behavior change. Recognizing the type of change talk a client is using, for example, preparatory or mobilizing words a client is using, can help the practitioner choose his or her response intentionally, with the goal of steering the conversation toward action-oriented change talk. Different techniques are used to elicit change talk. Examples of some techniques that help clients shift from the preparatory phase to the action phase are asking evoking questions, asking for elaboration. The practitioner can ask for examples, and they can explore goals and values. When the practitioner can identify change talk and use it in conjunction with MI, the client is better suited to make a behavior change. Empathy is an important capability which all practitioners and therapists must develop. The ability to disconnect from your personal feelings is particularly important in creating an effective and constructive relationship with your client. Empathy is defined as the capacity to share and understand another's state of mind or emotion. It is often characterized as the ability to put oneself in another's shoes. So, in other words, it is in some way experiencing the outlook or emotions of another being within oneself. Empathy has been found to be a consistent predictor of change. It was found that there was a significant direct relationship between therapist empathy and behavior change, showing the client's perceptions of therapist empathy was associated with significant improvement in behavior change. One study showed that not only must a provider be empathetic towards the client, but the client must perceive genuine empathy from the therapist to make a behavior change. Because of this, empathy should characterize all healthcare professionals and clients' communication in order to achieve the desired goals. Because making lifestyle changes are difficult for most people, it is our job as practitioners to create a successful program to elicit change. The combination of MI and TTM can create an ideal space for a client to make a behavior change. The next 2 slides are my references for this PowerPoint, and thank you for listening.